I'm based outside of Philadelphia, but we have analysts around the world. Couple of unique things about us is all of our analysts came out of industry. We understand. I started my career working at Johnson & Johnson 32 years ago on the shop floor, automating systems. I was responsible for computer system validation when computer system validation was just coming out through the quality system regulations in FDA. I was actually responsible for a lot of the things that we deal with today, and I'll talk about that. We also have built a very strong, trusted relationship with FDA officials. So very often, we pick up the phone or send an email around what is the FDA's perspective on, you all saw the new guidance on CSA. We've been involved with that guidance for the last 4 years since its inception. We've provided input and feedback. And that's extremely important. Very often, our clients use us as that anonymizer. I have a cousin who has a friend who has a nephew and a niece who has a problem with their toe. That's what we often do with FDA because nobody in industry wants to talk to FDA. But FDA is people. And we enable what we call positive disruption. And I'll talk a little bit more about that. Our disclaimer, our safe harbor statement, anything that I shared today is based on our primary quantitative or qualitative research, our interaction with regulatory officials, industry executives, and our clients. So let's start with what's the new normal? We get asked all the time, what's happening after COVID? What is going to be the new normal? How are we going to operate in the future? And the answer is we're living in the age of continuous disruption. Disruption is here to stay. We were done with COVID, and then we're dealing with hurricanes. And we're dealing with droughts and wildfires and tensions on the South Islands, on the South China Seas, and a war in Europe. So disruption is here to stay. We need to figure out how to ride the wave of disruption and turn it into positive disruption. And in order to do that, you need to think about the fact that, the old saying, necessity is the mother of invention, then disruption is the matriarch of transformation. We've lived through disruption, but we learned a lot through that disruption. And Benjamin Franklin said that when you're finished changing, you're finished. So if, as an industry, we ever stop changing and improving, we're done. And industry executives agreed. We did a poll during COVID, and what we found was 76% of industry executives told us that their digital transformation initiatives are being accelerated as a result of black swan events. And if you're not familiar with the term, Nassim Taleb actually wrote a book on black swans. And if you live on this part of the world and you've seen swans, they're white. But there is such a thing as a black swan. They're not very common, but they exist. And he used that metaphor to discover and discuss events that have 3 characteristics. Number 1, they're rare. They don't happen very often, but they have extreme impacts. And looking back, retrospectively, we all say we should have been more prepared. So think about any of the black swan events I just mentioned. And disruption, huge impact, and looking back, we could have been more prepared. However, when we ask, how ready is your organization for the next black swan event? We heard that 38% are already adapting and transforming their organizations. 54% are telling us that they are working on adopting, and 8% say that they don't plan to adopt at all. Good luck to those companies, right? They're the ones who are going to stop changing. And you're always going to have those organizations who are going to say, this is the way we've always done it. We know how to do it this way. Paper is great. In our industry, I call paper the industry's blankie. If you have a toddler, or we've had a toddler, or you know a toddler, it feels good if you saw the movie, the show. Don't take away my blankie, right? But we all need to grow up, and at some point, take the blankie away. One of the other challenges as an industry is that over the last 2.5 years since COVID, we've been doing a lot of reactive technology implementations. This is a picture of the little Dutch boy putting his finger on the dike. And that's what we've been doing as an industry. We've been implementing a lot of technology. Oh, we now need to work from home. How am I going to sign documents from home now? DocuSign. It's not a plug for them, but they did great. Really old technology. But in our industry, we didn't know how to sign documents electronically because we were doing everything on digital paper. It's a PDF. It's digital paper. I got a lot of calls from VPs of quality saying, how do we handle it now when I have my QA person who needs to review an exception, but the QA person can't be on the floor, and I don't have the ability to show them the stuff. So we take a picture, or we scan the paper record and show it to them, or they come pick it up, and people then Lysol the paper, literally. Or I heard of cases where people were putting papers in the microwave during COVID, not recommended. Kills the virus, but also starts a fire in your house. So it's all about how can we become more proactive. And regulators are paving the way. They're taking the excuses away from our industry. And don't get me wrong, in the past, regulators have been the limiting factor, the barriers to the implementation of new and modern technologies. But over the last few years, that has changed. The problem now is internal. As an industry, we equate compliance with quality, and they're not the same thing. If you work for any other, if you have a quality role in any other industry, your job is to lower cost. You improve quality, and by improving quality, you're lowering cost. In our industry, we did a survey. 85% of respondents told us that the role of quality is ensuring compliance with either internal policies and procedures or regulatory requirements. We cannot continue doing that. And I'll give you an example. I was in Albany, and in front of this restaurant, there was this sign: excellent compliance. Went in, had the food. Nothing to write home about. Excellent compliance, but the food wasn't good. Now, drive down any highway anywhere in the world, and you have those little stands. I'm originally from Argentina. So, you'll have stands everywhere. Best barbecue this, best fried that. And you eat it, and it tastes awesome. And a couple of miles down the line, you're looking for a gas station. Because the quality was great, but the compliance, not so much. And what you want is both. Compliance is a baseline. If you use a sports analogy, to me, football means actual football, where you kick the ball with your foot, looking forward to the World Cup. But American football, right? Just because they didn't throw any flags, you didn't have any penalties, it doesn't mean you're going to win the game. To win the game, you actually have to produce high quality as a team. So the difference is we cannot continue to interchange compliance for quality. Compliance is the baseline. It's the rules of the game. We must comply with all regulatory requirements, period. However, that's not the job of quality. The other key trend that we're seeing is FDA is transitioning from documented evidence to digital evidence. This is a term the FDA originally coined as it relates to modeling and simulation. Tina Morrison at the FDA, who run that team, talked about regulatory grade digital evidence. And now the term is being used more broadly across the agency to look at how can we get better at analyzing all of the data that we're getting across the biopharmaceutical and medical device product lifecycle. So if you don't believe me, Dr. Janet Woodcock, who's now Principal Deputy Commissioner at the FDA, not the commissioner if you are going to answer the survey, said that the vision for pharmaceutical quality is a maximally efficient, agile, flexible manufacturing sector that reliably produces high-quality drugs without extensive regulatory oversight. So here is top brass at the agency saying, we don't want to have a lot of oversight, but in order to do that, you need to do something for us. You need to be efficient, agile, flexible, and produce high-quality drugs. Unfortunately, in our industry, we make 5.5 sigma products with 3 sigma processes. And the way we do that is we don't build quality in, we test quality out. It is extremely inefficient. We throw money at the problem. And in the not-too-distant future, it's going to be harder for us to throw money at the problem because the Inflation Reduction Act has built into it price controls. First is 10 drugs. I was at a conference last week. Dr. Scott Gottlieb, former commissioner, talked about it. First is 10 drugs. I believe it's 2026. And then they can go to VA pricing. And the following year is the top 15 drugs. They're not the same drugs because once you negotiated the top 10 and they fall off the bottom, then the next 15. So he said within 5 to 7 years, 100+ drugs are going to be at VA pricing. That's going to cut into profit margins. And in order to make up for that, we're going to need to become a lot more efficient. We're going to have to design quality in rather than test quality out. So the agency is actually moving forward and looking at what are the quality assessment challenges that they have internally. This is from our analysis of FDA documents. You can go and look for them. You can Google them. They're out there. Nothing I'm going to tell you is confidential. Everything I'm going to tell you is analysis and putting the dots together, putting the pearls into a necklace. Right? So they have high volume of applications. They have the user fee program that expects shorter timelines for approvals. They have the commissioner, Congress, the industry, the public expecting a more efficient process. And they have technology advancements that they're leveraging. In addition, internal challenges are around freestyle narrative assessments. If you look at a document, then I do a lot of cutting and pasting from this place to that place is what I like to call swivel chair integration. Right? I looked it up in this system, then I swivel my chair and enter the same information into that other one so that I can get visibility. That is not valuable. As an organization, the FDA recognized that they're very inefficient. So in order to do that, they're looking to improve. And how are they doing that? They are moving to a one quality voice at FDA, an integrated approach where you can look at manufacturing assessments, drug substance assessments, biopharmaceutical assessments, as well as drug product assessments holistically. That is going to be a game changer. And we need to be ready for that because they're moving to a team-based integrated quality assessment approach where they're evaluating our products across the entire life cycle. In addition to that, they're expecting us to have high-quality processes that enable less regulatory oversight. So as we're speaking now, the FDA is having a meeting around QMM and CASA and how do you bring the two together. Quality management maturity is something that other industries have embraced for decades. As an industry, we're being so hyper-focused on GMPs, on compliance, that we really haven't paid a lot of attention to quality. And the regulators are telling us, pay attention to quality. True quality, not compliance as quality. So what is the agency doing? They're modernizing the regulatory assessment with CASA. So what is CASA? CASA is the Knowledge-Aided Assessment and Structured Application. Another answer for the quiz. And it's really intended to manage knowledge. You will hear a lot about knowledge and product lifecycle. Those terms being used very often by the agency. So when the agency mentions a term multiple times, we should pay attention. So the intent there is knowledge management across the product lifecycle, being able to build risk algorithms and decision trees, being able to do computer-aided analysis, AI, and machine learning. Looking at structured assessments, not unstructured data, and then integrating with other systems within the agency. So if you think about it, look at the right-hand side. It's knowledge management during the drug product lifecycle, the entire product lifecycle. From the original idea that a chemist or a PhD wrote on a napkin all the way to the patient and back. And it's based on knowledge, and it's knowledge-aided across the board. Now, the agency and other regulators around the world also realize that one of the challenges is once the drug is approved and we get that PAI, we're not touching that facility. Even if making improvements is going to help. And the reason why is because historically, anytime you made a process change, you needed to go back to the regulators and ask for permission. You can't ask for forgiveness. And when you ask for permission, they might say no. Furthermore, they might say, or worse yet, they might say yes, but the way you've been doing it up to now is no good. So as regulators around the world got together through ICH, they came up with ICH Q12. They've recognized that changes in the past took 3 to 5 years, and there were tremendous costs. So what ICH Q12 is trying to do is give us operational flexibility. And what is it about? If you think about it, at the top, we have knowledge management, which is our current pharmaceutical quality system that we all know and love. Right, we have CAPAs and management reviews, and you need to have the PQRs and the entire process. All that is knowledge if we actually distill it. Otherwise, it's just useless data. The intent with Q12 is to bring it together, and then based on knowledge, there's going to be a stimulus for change, hopefully an improvement, not a corrective action. And then when you evaluate the change, you look at your change approval. And then Q12 gives you the opportunity to say, is it a minor change? Is it a major change? Do I really need to notify the regulator before I do it? Do I need to ask for permission? Or do I do it in my annual? Or do I not have to notify them at all? It gives us a framework to improve. And we need to leverage that across the entire product lifecycle. In addition to that, the FDA published their One Quality Voice. And if you look at what are the key points within this document, you see product quality platform and informatics, you see quality metrics. By the way, quality metrics, FDA got statutory authority to have quality metrics back when President Obama was in the White House. FDASIA Title 7, Section 706 says that the FDA actually is entitled to get any information that they can get in an inspection, in lieu or in preparation for an inspection. And that's the authority that the FDA actually used during COVID to do remote regulatory assessments. And by the way, the FDA last month, we're in November, month before last, issued new guidance stating that remote regulatory assessments are here to stay. They're an awesome tool. They can do it very cost effectively. And they're asking you for data. And by the way, you need to provide that data to them in electronic format. They don't want it in snail mail. They don't want it on paper. So if you have it on paper, you're going to have to scan it and send it to them electronically. That's a signal to me saying, maybe we should move away from paper. Now, the other piece is around the regulatory frameworks to drive manufacturing innovation. The FDA actually implemented the emerging technologies team to have early dialogue. We're planning to use continuous manufacturing. Should we not? We actually worked with a client, with a pharmaceutical company and a technology organization, went to talk to the FDA. The person we talked to was Dr. Tom O'Connor, who's really knows continuous manufacturing because before joining FDA, he worked for ExxonMobil. He has a PhD from Princeton, and his specialty is continuous manufacturing. So the agency is bringing in experts from other industries that know the technologies very well, but they're giving us the opportunity to meet with them early on so that at the time of submission, there are no surprises. If we're not going to talk to them early on and we're going to use this novel technology and the reviewer doesn't know anything about it, never heard of it, then that's going to delay your process. By engaging with them early, you get a huge opportunity. In addition to that, the FDA has put together the Framework for Regulatory Advanced Manufacturing Evaluation, or FRAME. And they're going to focus on end-to-end continuous manufacturing, distributed manufacturing, point-of-sale manufacturing, and the use of AI in our industry. They're putting together a regulatory framework to help us implement these kinds of technologies. So the excuse of FDA isn't going to accept it is not there anymore. They actually published a draft report around distributed and point-of-care drug manufacturing. You know, we're smart sourcing now, right? One of the things we learned from COVID is having long supply chains is a problem. During COVID, there was a container ship stuck in the Suez Canal. That backed up all traffic across the Suez Canal. Imagine the same thing happens in the Panama Canal, right? We don't know when the next disruption is going to be, so how can we ensure that we have availability of products for patients? Another huge obstacle has been computer system validation. And as I mentioned, I bear some responsibility for this. So in the early days of CSV, while working at J&J, I was responsible for all manufacturing applications. And being young and naive, I volunteered to be the operations representative for computer system validation. And I had a peer in quality, and we both came up with our policies, our procedures, our approaches. And what we did at the time, everything was very immature. So at the time, our focus was, what documents do you need to create? So when somebody wanted to implement a new application, I opened my Lotus 123 spreadsheet, actual Lotus 123. Some of you are way too young to know what I'm talking about. And I would tell you, okay, is it a custom system? Because we didn't even have GAMP yet. This was pre-GAMP. Well, I think it's custom, so all right, so you're going to write code? All right, I need a requirement spec, I need a design spec, I need a detailed design spec. Trace matrix, I want you to do unit system integration testing, IQ, OQ, PQ validation, summary report. When you're done with all those documents, come back and I'll review them. Right? That was our focus. How many documents did we need? And frankly, our vendors, our partners, our technology suppliers weren't ready. They didn't know how to comply with these regulatory requirements. So we had to do it. I actually attempted to audit Microsoft. It didn't go very well. They sent me a list of all the pharmaceutical companies that were using their products, which today makes a lot of sense, but back then I was furious. I need to see your development, your SDLC for Excel, because we're using Excel in order to calculate the yield on all our products. But that was the thinking back then, and at the time, it was appropriate thinking. Based on the information we had available, that was the right thing to do. Now, I think what's important to note here is Francisco Vicenti from FDA, who leads the Case for Quality initiative and is the primary author of the new guidance on CSA, recognized that 5 years ago. And we've been working on this guidance ever since. And it finally came out. Now, when we asked industry, what's the primary barrier to validating cloud solutions? The number one answer is lack of regulatory guidance. We don't have that excuse anymore because CSA clarifies it. The second answer is culture. As an industry, we have what I like to call regulatory inertia. The safest answer for a person who works in the quality department, when you come to them with an improvement, the safest answer is no. Can I make this improvement? No. Why? Because then I'm not responsible for that decision. I'm just implementing somebody else's decision, my predecessor's decision. And we're so risk averse that we don't want to take any risk. We use a risk-based approach, but everything is a high risk. That's not a true risk-based approach. So the new draft guidance talks about the fact, recognizes that the advancement in manufacturing technologies actually have allowed manufacturers to reduce sources of errors, optimize resources, and reduce patient risk. By using technology, we're actually improving quality and reducing risk. But I cannot tell you how many companies I go to and they say, well, if we're implementing new technology, then we need to do a risk assessment from scratch, as though we didn't have anything. What you have today is paper, and your operators are making mistakes on paper. On a computer, you can't make those kind of mistakes. If you're connecting the pH meter directly to your MES, there's no operator involved. You validated that if the pH meter says 6.1, the system is going to read 6.1, and it's going to write 6.1. When a person does it, I mix my 3s and my 7s and my Ls and my Rs. And most of us are terrible at transcribing things because we transpose things. So the agency recognizes the potential. So what are we doing about it? If you remember, I told you what we did back in the day was focus on documentation. At the top end of the pyramid was how much documentation can we create? And then we looked at what are the other things that we can do with very little critical thinking. What CSA does is it turns a triangle upside down and says, start with critical thinking. Look at the features and functions, not at the whole system, and what are the risks of this particular feature and function have on the hierarchy of risk: patient, product, process, regulatory, and business. And one of the examples is a learning management system. So let's say I'm trained to run this chromatography skid. I came in yesterday, I run it. My training expired at midnight. I come tomorrow, I run it. I'm not trained. What is the risk to the patient? 0. What is the risk to the product? 0. What is the risk to the process? 0. What is the risk to the regulatory, to the quality system? High. And what's the risk to the business? Very low. Why? Because I am an analog entity, and at midnight, my memory didn't get wiped. And if I knew how to run the chromatography skid yesterday, I still know how to run the chromatography skid today. So that's the kind of critical thinking that we need to use. Being critical is not the same thing as applying critical thinking. And in our organizations, very often, we focus so much on being critical. No, that won't work. No, that's high risk. No, that's too much. No, that's too little. Let's apply true critical thinking to make that happen. And the phrase that Cisco loves to use is the records need to be of value to the organization, not only to the auditor. How many of us are creating records just so that the auditors can look at them? That adds no value. Yes, do you want to have a login for auditor, or do you want to have a report that the auditors can see? Sure, that facilitates the process. But creating mountains and mountains of data just for the auditors, just in case, adds no value. So let's talk a little bit about how do we get there. Digital transformation is an imperative for our industry. No two ways about it. Those who don't transform, those who don't change, will stay stagnant. So we came up with what we called good technology practices. How do you enable this digital transformation? You need to have culture. We'll talk about each one of these individually. So first, Deming said, culture eats strategy for breakfast. He was a strategy guy, right? But if you don't have the right culture, nothing matters. We, as an industry, work so much within our swim lanes. I'm in R&D. Oh, no, I'm in discovery. I'm not just in R&D. I just do early discovery, and I document everything in my green notebook that's numbered. Or maybe I have an ELN now, and it's a paper lab notebook, an electronic paper notebook. But that's all I do. How many patents can I file? That's my measure. And I'm not being negative or facetious. You know, that human beings are very good at doing what we're incentivized to do. So if your incentive is how many patents you're going to file, you're going to figure out how to file a lot of patents. If your incentive is how many widgets you're going to put out the door, then you're going to figure out how to make as many widgets as possible. If your incentive is how few 43s you're going to have, then your incentive is lower number of 43s. But as an industry, we're so focused on our lane that we forget that what we do impacts the entire product lifecycle. And if we hoard the knowledge, we're not going to be able to improve. So we did a survey. What's the primary barrier to digital transformation in life sciences? The number one answer, culture. Culture will eat strategy for breakfast. You can have the best digital transformation strategy if your people aren't going to support it because they don't believe it, or they don't buy into it, or they weren't involved. It's all for naught. Now, when we looked at this data, we actually sliced it by those organizations who self-reported that they believe that current regulatory frameworks fully support digital transformation versus those who reported that current regulatory frameworks do not support digital transformation. Now, the regulatory frameworks are the same. We didn't change the frameworks. It's what FDA and EMA and all the regulatory requirements are asking us to do, but it's the culture that's different. And of those organizations who believe that there's alignment and they can improve, 91% of those are undergoing digital transformation, compared to only 41% of those who believe that the frameworks don't align or are a burden. Now, the challenge is most of those organizations are thinking about the regulations of the past. Blue ink or black ink? How many of you, what color ink do I sign my documents in? Blue ink. Raise your hand. We've got a few brave people, and the other ones are black ink. Why? Nowhere in the regulation does it say the color of the ink. It says that it needs to be permanent, indelible, and legible. The source for that were copy machines when they first came into the workplace 40-plus years ago. They didn't pick up blue. So some companies wanted to know, to be able to discern original from copy, and some wanted to have a complete copy of the original. And that's why the blue and black comes from. Yes, so at your company, if the SOP says you can only sign with blue ink, you're right, at your company. But that's 40-year-old technology that you're relying on today, and you're making decisions today based on that. So let's look at the fact that technology is always evolving. I'm an electrical engineer by education, Moore's Law. Moore's Law says that the number of transistors in an integrated circuit will double every 18 months. Bring it more broadly, the computing power that is available will double every 18 months. So every 18 months, you can get twice as much computing power for the same price, usually, in the same form factor. Now, when I started working in 1990, I could afford to wait 10 years to replace my computer because, look, it didn't change so much. The computing power didn't change so much from a 286 to a 386 to a 486 to a Pentium. Yeah, it was a little better, but now look how the hockey stick curve goes up. And now, if you're not modernizing, you're always behind. And everybody's now talking about what we want to do is be in the cloud, the cloud, the cloud, the cloud. Now, the cloud is going to be obsolete at some point, so let's not get hung up on the cloud. Companies today, life science companies, are using quantum computing to accelerate R&D. And they should. And when we go to biological computing, we should look into that and whatever is next. We shouldn't be stuck on what we're comfortable with, because the Egyptians would, who invaded paper would feel very comfortable in a pharmaceutical company. So let's look at, if you're not modernizing, you're out of compliance. This actually came out of a discussion in a meeting at FDA, and a number of FDA officials said something along these lines. If you're not modernizing, you're out of compliance. So what's FDA doing? FDA, back in 2009, we had the opportunity to talk to Dr. Armando Oliva, who at the time was director of heading bioinformatics at the FDA. And he said, at some point in the future, I can't tell you when, I expect all information to come into the FDA electronically so that we'd be able to do that. Well, 2019, FDA rolled the Technology Modernization Action Plan, and 2021, Data Modernization, and 2022, Enterprise Modernization, and in 2021, the launch, the Office of Digital Transformation, under Vid Desai, who, by the way, came from industry. So the FDA is modernizing, and the last thing you want is to be behind your regulator when it comes to technology. If your regulator knows more about your product than you do, you're in trouble. So anybody in your organization who says FDA isn't going to accept the cloud, this is the first item within the Office of Digital Transformation. Imperative number 1, cloud strategy and continued adoption of as-a-service models. And you can go down all of those, and they're basically digitally transforming. You can take their plan, putting in your organization, it will work. The next point is you need to get your digital house in order. As an industry, we suffer from what I like to call drip. We're data rich, but intelligence poor. We have petabytes and yottabytes of data sitting there gathering either physical dust in some former Iron Mountain or in a hard drive somewhere. And Dr. Califf, ding, 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 another answer. He was the 25th and 22nd Commissioner of FDA, actually said by themselves, data are meaningless. Only when you add critical context do they become information, and only then can you use them to guide decision making? So just because you have a lot of data is not enough. And by the way, don't start your digital transformation project by saying we're going to create a data lake and throw everything we have into it, because all you get is mud. You need to have context. Master data management and governance are the foundation to digital transformation and data integrity. If you don't have that, you're in trouble. And unfortunately, as an industry, we're not very good at master data management. Quality metrics. We talked, just kind of bringing the circle back. What is the reason that companies aren't implementing quality metrics? And the primary reason, the top reason, is lack of process understanding. If you look at the quality metrics, the three that we negotiated with FDA, out of specs is one, and industry is still pushing and saying everybody calculates out of spec differently. No, it's either in spec or out of spec. It's not a complex calculation. We need to get with the program, otherwise the regulators are going to tell us what to do. The other issue is digital threads. We all hear a lot about this digital thread, the MES digital thread, and the product realization digital thread, and the post-market surveillance. The problem is I'm not Neo, and I cannot read the matrix. It doesn't tell me anything. All these digital threads are useless. What we need is weave all those digital threads into a digital fabric, because the data doesn't belong to the system or to the department. It belongs to the product. So by weaving all those digital threads into a fabric, we can actually do digital twins and modeling and simulation across the entire product lifecycle. We need to have a unified modern platform. And that doesn't mean monolithic. That doesn't mean you buy everything from one vendor. That means you look at technology, you partner with organizations, and that's one of the great things about being here today is, Yash and Look invited some of the companies that could be their competitors, because it's for the betterment of all of us if we work together. The problem is in the current state, we have paper binders and paper on glass and standalone solutions and integrated solutions. And what we're proposing is we have the opportunity to leapfrog from where we are today to what we call digitally sustainable models that are proactively seeking tomorrow's technologies today. So let me leave you, I have 27 seconds. Let me leave you with some final thoughts, because I'm standing between you and another drink, for those of you who already had one. What are the final thoughts? Digital transformation is an imperative in the age of continuous disruption. And you're never done with digital transformation. You may be done with a project, but digital transformation is a process, not a project. Just like you're never done with continuous improvement. You always have to continuously improve. There are no more excuses. The technology is ready. It's not a technology problem. When I started 32 years ago, the token didn't go around the ring fast enough. Today, you can drop fiber anywhere. You can put a satellite truck and get high-speed connectivity anywhere in the world. The regulators are paving the way for us. They're actually almost begging us, please modernize. We're running all these workshops. We're writing all these reports, but nobody's reading it. It's the tree falling in the forest, and nobody's there to hear it. We're happy to share everything that we hear. Our job is to read it so you don't have to, right? But let's share it. Let's be aware of what's going on. You need to stay ahead of your regulators. As I mentioned earlier, if your regulators have better technology than you do, and they know more about your product than you do, forget about 483s, right? We need to stay ahead. Follow these good technology practices that we talked about, right? They're simple. They're straight to the point. They're not complex. It's common sense. Unfortunately, Voltaire said common sense is not so common. work across the swim lanes to improve outcomes. Ultimately, our objective is how can we improve patient outcomes? How can we align and work across the swim lanes to achieve these goals? Engage with partners who share your culture and your vision. Remember, you're not buying products anymore. You're not buying commodities. You are partnering with an organization that is going to be with you for a long term. It is a long-term commitment and a long-term relationship. So don't look just for the price. Look for, does their culture align with ours? Does their vision align with ours? Are we going to be able to work together? Embark on a journey to digital sustainability. Always be striving and looking for tomorrow's technology and implementing it today. Because we really need to change the way we do business. We cannot continue to always do what we've always done, because then we'll always get what we've always gotten, and we'll be surprised. So I'm really honored to be here today. It's a great opportunity for all of us to work across the swim lanes, to collaborate. We have experts from around the world, from industry, from consulting firms, from technology companies who share the vision. Otherwise, you wouldn't have invested the time and effort to be here. Let's make this event a success by communicating, collaborating, and looking for ways to improve. Thank you very much.